Hello everyone. So today we will be discussing about the addiction and mental health, looking at the dual diagnosis and integrated treatment plan. So first we should know what is addiction. Now addiction is a chronic disease that is characterized by compulsive drug sickness and use despite the harmful consequences. So it affects the brain function and behavior. People with addiction often have intense focus on using certain substances like drugs and alcohol to the point where the person's ability to function the daily life become impaired. What is mental health? Mental health includes emotional, physical, and social well-being. It affects how we think, feel, and act. It also helps us to determine how we handle stress related to others and make choices. Now, how they are interrelated? So there is a strong link between the addiction and mental health. People with mental health disorder may turn into the substances as way of coping with the difficult emotions or symptoms. So, controversially, addiction can disrupt the brain's chemistry, leading to or worsen the mental health problem. Now, what are the types of mental health disorder commonly co-occurring with addiction? So, there are four mainly: anxiety disorder, depression, PTSD, and bipolar disorder. Now, what is in the anxiety disorder? It is characterized by excessive worry, fear, and physical symptoms like rapid heartbeat and shortened breath. So, people with anxiety may use the substances to self-medicate and cope up with these symptoms. Now, depression involves the feeling of sadness, hopelessness, and loss of interest in any activity. So, people with depression may use substances to numb the emotional pain or improve the mood. So, in PTSD, develops after the experiencing or witnessing the traumatized event. Symptoms can include flashback, nightmare, avoidance of reminder of that trauma. So, what people do? People with PTSD may use substances to self-medicate and cope up with their emotions. Now, in bipolar disorder, it is characterized by alternating episodes of mania, that is, elevated mood and energy, and depression. So, people with bipolar disorder may use substances to manage the mood during the depressive episode. Now, coming to the diagnosis. So, what is dual diagnosis? Dual diagnosis is also known as co occurring disorder, is the presence of both mental health disorder and a substance use disorder in the same person. So, it is commonly occurrence affecting millions of people worldwide. Now, what challenges we face during dual diagnosis? So, there are several challenges associated with the dual diagnosis. Accurately diagnosing both conditions can be difficult as the symptoms may overlap with each other. So, people with dual diagnosis also at a higher risk of relapse for both disorders. So, additionally, stigma associated with both addiction and mental health can make us difficult for individuals to seek help. So, access to the integrated treatment program plan that addressing both conditions simultaneously can be limited. Now, coming to the benefits of integrated treatment. So, addressing both mental health and addiction concerns simultaneously, integrated treatment plan takes holistic approach. So, addressing underlying cause of both addiction and mental health disorder. It improves treatment outcome. How? By treating both conditions together. Integrating program can lead to better long-term result for an individual in recovery. It reduces the risk of relapse. How? Integrated treatment plan helps us to individual to develop healthy coping mechanism, addresses the trigger that can lead to the relapse for either addiction or mental health disorders. It provides more holistic approach to recovery. Now, what we do in integrated treatment program focuses on the whole person, not just on the symptoms. So, this approach can improve person's overall well-being and quality of life. Now, what are the components of integrated treatment plan? There are in and all five components we should focus on: individual therapy, group therapy, medication assisted treatment plan, skill training, and case management. Now, what we do in the individual therapy, we provide the safe space for the individual to explore the underlying causes of their addiction and mental health that struggle developing coping mechanism and works towards the recovery goal. So, in group therapy, it offers peer support and allows individuals to connect with each other who understand their challenges. Now, in medical assisted treatment plan, what we do, it may be used to manage the symptoms of both like addiction and mental health disorder, reduces craving and withdrawal symptoms. Now, in skill training, it teaches individual important life skills such as stress management, communication, and relapse prevention. In case management, it provides coordination between the treatment provider, health connected individual, and necessary source that monitors the progress. Now, specific treatment approach for dual diagnosis. Now, treatment for dual diagnosis should be individualized and address both addiction and mental health disorder. So, there are some common treatment approaches like cognitive behavior therapy, dialectical behavior therapy, and motivational interviewing. So, in cognitive behavior therapy, it helps individual to identify and change the unhelpful thought and behavior patterns that can to contribute to the both addiction and mental health symptoms. In dialectical behavior therapy, teaches to skill managing the emotions, reducing the self-destructive behavior, and improving the relationship. Now, in motivational interviewing, it is a collaborative approach to the help individual exploring their ambivalence about the changes and build a motivational for recovery. Now, what is the role of family, friends for supporting recovery? Now, and friends play crucial role in supporting recovery in the dual individual. Which are the ways? So here are the some various ways to help individual. So educate themselves about the addiction and mental health disorder, provide emotional support and encouragement, help with the daily tasks and activities, set a clear boundaries and expectation, advocate for their loved ones' need. Now there are advocacies and numbers of advocacies and resources are available for individuals with a diagnosis. So here are the few examples which you can get help. Now coming to the conclusion, addiction and mental health are a complex issue, but effective treatment is available. Integrated treatment plan program is addressed for both conditions, simultaneously offers the best chances for long-term recovery. So, with the support and self-care, individuals with dual diagnosis can lead to the healthy and fulfilling lives. Thank you for the patience hearing.